Hi everybody, this is Rhonda with the Center of Wellness for Urban Women, and I am trying something new. I'm actually not on my iPhone, I'm on my laptop, and so we're going to see how this works. But I hope everybody is having a good holiday weekend. I am chilling this weekend. I'm not doing very much, but I definitely wanted to make a video. I'm actually going to back up a little bit. And kind of catch up and kind of talk about some of the feedback that we got for the past couple of videos, and then also some of the things that are happening with CWUW, and also I wanted to talk about provider-patient relationships. So in the past couple of weeks since the last video, I've definitely started to work out. And the biggest thing that's been really helpful for me is to walk. I have a dog, Zeus, and some of my Facebook friends have seen Zeus. He is an interesting little character, but we go to the dog park, and as he is playing around, I actually just walk because it's an enclosed dog park. So I'm able to kind of walk around and loop and run. Zeus pays no attention to me while he's in the dog park. It's all about him. So there's no playtime with mom. It's about him. So I just walk and walk and walk, and then when I'm done, I walk towards the gate, and he kind of runs to me. So that's one way. Close by where I live, there's a walkway. It's called Eagle Creek Greenway. And it's a space for people to bike and walk and do all that kind of stuff, and so I've been doing that as well. So that's been, and it's literally like 2 minutes walk time from where I live, so that's been really convenient. Also really utilizing kind of my own little home gym. And I don't have a lot of equipment, so I don't have a treadmill and all that stuff, but definitely I'm a video person. I have a lot of DVDs, and so I do have P90 like everybody else on the planet, and so I'm starting to not do the series as it's set up, but do as I need it. There's definitely some of the DVDs that I think really are good for my body, and so I've been pulling those out, especially the Stretch X. Oh my gosh, it's good. And then also I kind of go old school with this, with The Firm. I love that DVD. I wish they would update that particular series, but I use that because it's actually, you know, a lot of it's overall conditioning. But the point is, I'm using everything that I have at my hands. So, and that's something that I want you guys to do, is kind of think about the different ways, because it's about physical activity. And I think sometimes people get really caught up in wanting to be the super athlete, and really if you just keep your body moving, it's going to help. Yes, you have to get your heart rate up. Cardio is important, and strength training is important too. So you have to kind of combine those things, but I'm just saying find different ways to do it. Eating has been pretty good. Trying to really still eliminate some sugar. Also had a conversation kind of online with a dietitian about my vegetarian thing, and she suggested maybe not may not be a good thing, because what happens in the vegetarian lifestyles, a lot of things are replaced. Meat is replaced with soy. That's a lot of the ways people get protein. Well, I have a little allergic thing with soy. It's not severe, but doesn't really sit well with me. And that's not to say I still can't go vegetarian. It's just talking about the discipline level that it would take for me to really go vegetarian and at the same time not increase my soy intake. So I'm still going to kind of do a little bit more research on that, and still kind of think about if that's the choice. I just don't want to feel the need to hold on to being, you know, full-time meat eater. I mean, that's kind of how it is. also, so I did want to talk about CWUW, the Center of Wellness for Urban Women, and who we are and what we do and our plans for this year and for the future. If you haven't already liked us on Facebook, please do. It's facebook.com/CWUW online. And I really love that online group. Well, it's actually a page, but that community. Just been able to reach out to a lot of women and men via that social media. And it's great. Like the feedback. I like the conversations that we have over there. So if you haven't liked us, please do. We also have our blog, and like I said before, we have bloggers from all over the country, and adding some more soon, hopefully. We're also on Twitter. We have a Pinterest page, and of course our organizational website, which is CWUWonline.org. And so we really try to do social media with full force, because I think it's another way to get to disseminate information, to connect people with resources. We've been able to connect people to even medical providers and things like that in their city. Just so it takes a little time. We have to make some phone calls, but we do what we can. It's not a place for us to give medical advice, but we do our best to connect people with those resources they need, with any questions that they may have. So who are we? We are a group. We are 100% volunteer organization. Nobody is paid staff as of yet. We have approximately 8 or 9 full-time volunteers. I'll put it like that. That includes also those who are part of our board, and those who lead our programs as program managers. And so right now we have about 3 programs that we're really concentrating on, and one being the Sisters Together program. It is a part of a curriculum, which is a part of the National Institute on Health, and we are a partner with them on this program. It is a physical activity nutrition program. It's a way to help women to increase their physical activity and to look at their dietary needs. It's not about diet as far as restriction, but it's about learning how to eat for your lifestyle, and what you need to do for your health. And health has to be individual. It can't be about what the next person is doing, or whatever big trend is happening. And that sometimes people get caught up in. They see people doing certain things and they want to do it. It's really about your own health journey. You really thinking about how you want to apply some of these health tools to your life. And so Sisters Together is that kind of program. We started off walking on the canal a few years ago. We're actually going to take a step back this year and kind of rethink it, do some community assessments, get some data. We really want to be data driven, not just off the cuff, and do some focus groups to really get into the community and talk about what the needs are, and what are some barriers for women. And I know for African American women, a barrier that really bugs me is the hair situation. And it's unfortunate that women won't work out because of their hair. So you got to really figure that out for yourself and work with your hairdressers. And there are some tools. The National Institute on Health is actually trying to look at developing a brochure. I really believe, I think last year the Surgeon General mentioned something about black women and their hair, and that being a barrier. Just don't let that get to you. I understand, believe me, I have friends who invest a lot of money in their care, and it is a part of our culture, but at the same time we can't let it get in the way of our overall health. So hopefully we'll be able to help tackle that issue, and give women some tools to, there are certain headbands and things that are out to help with that. But Sisters Together is a program that we're really going to push for the latter part of this year and ongoing. Also, we have something called the 7 Dimensions of Wellness workshop and program. CWUW's philosophy wraps around the 7 dimensions of wellness, and what they are is your mind, body, spirit. So your physical, emotional, spiritual wellness, and then there's 4 other things: environmental health, occupational, intellectual, and social. And so our programming, everything that we do, wraps around the 7. So we try to include those things. So even with Sisters Together, even the goals are physical fitness, so that physical wellness piece, we as an organization are looking to see how we can incorporate the other dimensions into that programming, and that's what we try to do with everything. So as you know, when I have these conversations, you notice I'm talking about mental health, and I'm talking about environmental health, and I'm talking about those things, because wellness is not just one thing, but it's about how you live, what's your lifestyle. So the 7 Dimensions of Wellness workshop is just teaching the participants what those dimensions are, how they intersect, how do they work together. And then they kind of brainstorm together the tools and in ways that they can incorporate those things into their life. We've also done this as a 10-week program with high school girls. We did it at a local high school. We did it for 2 years. Worked well. Loved it. It was really, really great, and hopefully we'll be able to do that with adults soon. So that's something that we're also modifying. So we've looked at what we've been doing for the past couple of years with that, and so making some modifications to improve it. Also, we have our community garden, and if you're on our Facebook page, you see us posting pictures, and community gardens are popping up all over the place, but understand that they have different goals and focus. Not everybody is setting them up just simply for food and food sustainability and food independence. There's other pieces to that, and so ours has more pieces to it. We see gardening as therapy. We're also part of that food sustainability movement. We really believe that food independence, food safety, all those things are very, very important, because we don't really, what they're doing to our food, a little scary. So take the time out to, in your local area, when you're going to be a part of a community garden, see what their focus is, so that you know that it's a fit for you. But we're also talking about garden therapy, like I said. It's a wellness garden, so we're incorporating art into the garden. Just the 7 dimensions of wellness, as before. We're really trying to do things at that place, partnering with other local organizations so that their clients can come in and participate and be a part of what we're doing there. So those are the main 3 things that we're doing. There's so many other things in the works. So many other things. Right now it's about capacity, and like I said, we're a 100% volunteer organization. We've been around since 2007, and our goal eventually, once we get it together and get what we really want to do in Indianapolis, is to be a national organization with affiliates across the country. We are very neighborhood based, so it's not about just doing the same program throughout the city, but it's neighborhood by neighborhood, community by community. So that is what CWUW is really about, and also that working with that individual about what they want to do with their health and wellness. We love CWUW. CWUW people love CWUW. So, like I said, we have great supporters all over the country. From Minneapolis, my brother Dan has been really supportive, and the Kaufmans in DC, and we have, Miss Ivy in Chicago. So we have really some people who are doing some good things for us all over, who believe in what we're doing and can't wait till we expand out. We can't wait either. Oh, and lastly, it's a program and event and fundraiser. It's called Life Jam. It's probably one of the very first things that we did. Life Jam is about that social wellness piece. I'm sure there's other dimensions of wellness that are in there, but that's the focus. It's social wellness. Is how we relate to one another, but it's also about music and art and health, how those intersect. We're really big on art therapy and music therapy, and using the arts to heal, and that is what that event is about. Life Jam is about embracing those elements for healing, and so locally we've teamed up with local musicians, local artists, the health department, different other agencies, to put on an event, a show. It's really kind of a show where you have performances and live art and health messages and things like that. We do that every year. We do that in November as a part of Art and Health Month. And so Life Jam, we're already starting to plan for our November event. We're excited. We love Life Jam. It is a headache to put together, but once it gets here, we get excited. And that's, like I said, that's who we are. We are CWUW, in that, these videos are about my own personal wellness journey, health journey, and my CWUW folks also have their own health journey. Sometimes it's not physical, sometimes it's mental, sometimes it's something else, but we are part of the movement. We're not somebody who, I'm sorry, my glasses are bugging me a little bit. We are a part of it. We're not just people who have developed this expertise. We're not just a bunch of public health people or social service people who think we have the answer necessarily, if you know what I mean. We want to take the journey with you. We want to learn with you, and we want to grow with you. Yes, there's some things we definitely feel like we are experts at, because we should. But at the same time, I'm on the journey, and I'm with you 100%. And CWUW is too, at all levels. So if you're not in Indianapolis, you're in Georgia, Texas, Boston. We had a young lady that connected with us from Boston who was really interested in our programming. You can be a part of CWUW with our online community. Talk to us about what's going on in your city as far as wellness. We will help to disseminate information, because it's about connecting, and it's about getting information to people. So don't hesitate to send me a message on Facebook. It's not always me. I have other administrators, but send us a message. Definitely we will respond, and if it's a program that fits in what we think will benefit the community that we're trying to serve, we will definitely hook it up either via the blog, or we'll tweet it out, or whatever, so we can get the message spread. We're also not an organization that is about kind of being jealous of other organizations and things like that. We are all in it together. There's, obesity, this health thing across the board, mental health, all that is huge. So we can't do it all. We're still little, we're kind of on the smaller side. We're still trying to grow, but so we have to connect with those organizations that also can help serve the community. So it's not about territory and things like that with us. So if you're an organization that is also helping in whatever way that you want to help, women's empowerment, youth, etc., education, etc., etc., let me know, let us know, and we'll help to get some information out there. And if you have any other questions about CWUW, let me know. I'm very open to talk about what we're doing and what our plans are. And I really just gave you a really small little snapshot, but you can go on our website, that's CWUWonline.org, CWUW online.org, and check us out and see what we have going on. We've done clothing drive. I do a clothing drive every year. Have bigger plans for that next year, and some things that we want to do. So we really try to, we really are very much a community-based organization. And so lastly, what I wanted to talk about, and this is a long video. I'm already at 20 minutes, so I hope some people can stay and watch for this whole thing. This last was provider patient relationships, and I'll really try to wrap this up really fast. But I think it's important. I just recently had fibroids, if people were wondering. Had some removed about 8 years ago, and had really just one that was causing problems. So it was excess bleeding, and that I thought was the only issue. It turns out that it was causing problems with my hips. I was having problems with my hips, and I thought it was the excess weight that I had gained. And after the surgery, I don't have problems with my hips. So who knew that was the issue? I didn't. I really was loving this whole thing of stretching and yoga, and all my hips hurt, and I really felt like an old lady. Like, you could see me like, ugh. And that little and it was a small one. It wasn't something big. Nonetheless, I had to get fibroids removed. And what is important, and what made me really think about talking to you guys about that relationship, is what happened to me right before the surgery. Is that I was at, of course, one of the local hospitals, which is also a training hospital. So you have all these interns and residents and etc. running around. So the surgeon in residence, is that what it is? Came in and started talking to me about my surgery. You're going to have this, you're going to have that, etc. Well, she mentioned some things that I was like, oh, I'm not having any of those things. And so I was simply getting the fibroid shaved, if you understand, what that process is. What she was talking about was, and I'm not going to use the certain medical terms, I just am going to tell you what it is, where they actually burn the lining of the uterus. That's what she thought. I was getting them shaved, and then my uterus was going to be burned to prevent future bleeding at all. Did nobody say nothing about that at all? So I was like, oh, wait a minute, hold up, and I said, no, I'm getting one procedure done today, and that's, we're just shaving the fibroids. And she said, are you sure? So she said, do you need to talk to your doctor? Yes. So, to get the doctor comes in. I love my doctor. I do. And so she's, she actually kind of had me confused in her head with somebody else. So I reminded her of the situation. Now, understand that with them burning the lining of my uterus, I would have had to get also my tubes tied. Now, I know we didn't have that conversation, because she just had to mention it right then and said, if I do this procedure, guess what, I also have to do this. I said, well, we didn't talk about any of that, and I want to research. I am that person. I'm going to look up some stuff. And I was like, nope, I'm not getting any of that done. And so at the same time, I had the RN and it was another nurse that was in there still trying to convince me to get this other procedure. And I had to stop them and say, this is not about your experiences or what you've heard. This is about my conversation with my doctor. This is what is best for me. Even though I'm 44 and there's a small percent chance that I can have a kid and all that kind of stuff, it's still about my body. To me, excess bleeding wasn't actually, I wasn't anemic, I wasn't having any problems. It was just annoying. I didn't see why I needed to get my uterus burned, taken out, all of that. It was excessive. All that is excessive. So I told him, no, I want to keep my uterus, and I'm going to work on the fibroid situation, excess estrogen and all that kind of stuff. So luckily I have such a good relationship with my doctor that she didn't question it. She didn't question my reservations about these extra surgeries. She simply said, gotcha, understood, looked it up, said, Rhonda, you're right. I'm not close to menopause. I don't know if that's good or bad. But close to menopause. I don't have any hormonal issues, not really. Like I said, the excess estrogen, I mean, that's one of they believe one of the causes of fibroids, but that could also be intake too. I don't know what I'm eating. That's what I believe. Anyway, so nonetheless, there's something to be said about standing your ground about your body, and we can get very intimidated. I had 4 people in the room with me at one point, all trying to convince me to have a certain procedure that I did not want to have, and I did not care. Because it was just really about convenience. It wasn't a medical issue. It wasn't that something was going to happen to me and then they were going to actually add on an additional procedure that we hadn't even discussed. So you really have to take the time out to have those conversations with your doctor. If you don't trust your doctor, you need to change doctors. You shop around as much as you can. I don't care if you're Medicaid, Medicare, or whatever. You can still shop around. Okay? It is a situation where they actually should feel like they're working for you. If you don't have a doctor that actually sits down and does a consultation with you before a procedure, or if you're a new patient and they don't take that 15 minutes to talk to you about who you are, what you think, and what you believe, you need to find a new doctor. And don't feel bad about it. So I really wanted to kind of talk to you guys about that. Rhonda, who I spoke about in the last video, also had a procedure. I think she actually did have one of those procedures, and she said she wants to do a video blog about her provider situation, because it went differently for her, and I encouraged her to do that. But I really want to make sure that you guys learn how to have that conversation and arm yourself. If you do have a medical issue, it's diabetes or whatever it is, do your research, understand what's going on with your body, as I said before, with your body. Understand if you have to get on insulin, what does that do to your body? How does it relate to other issues that you may have going on? If you also have high blood pressure, etc., etc. But you got to do your research and have an open dialogue with your provider. There's some good medical providers out there who want to help you and will take that time out to have those conversations. If you have a person who doesn't do that, X them. They gotta go get you somebody else. And I really believe that. It's just imperative at this point that we work with the medical community and make them serve us. I don't believe in pill pushers either. I think sometimes the doctors can be a little, drug dealer-ish to me. That's a Rhonda thing. You're not going to just give me a pill. I want you to heal me. And I've had to go back and forth with some doctors on especially pain medications. Like, you can't just push a pill on me. But that's me and knowing me, and that I don't back down, and I have those I really have conversations with people, my providers, about my take, my view on my body, all the way from the bulimic side of it to just how I approach health and wellness, as far as, like I said, pills versus trying to be more holistic and things like that. So if you have any questions about that, I know this is a weird long video but a bunch of stuff in it. Please, like I said, send me an email. I would love to hear feedback from you. We're going to continue with this. I'm actually going to try to take it outside once I get my iPhone thing a little better. I'm learning how to do this technology in the way that it should be done. I'm going to see how this works with using my webcam and to make, better videos. But I wanted to keep this a little more conversational and just about me and you. Like I said, if it's about one person, I'm good. This ain't about thousands of people viewing this. It's about one person who says, I need to hear Rhonda say what she's going to say. So I thank you once again. I want you guys to have a great Memorial weekend. Grill, have fun. We're in Indy, so it's all about race cars and all that stuff. That's why I'm staying in the house. Because I live near the track, staying in the house. But you guys have a great holiday weekend. Understand also, Kevin Powell's weight loss challenge on Facebook is starting their 30-day weight loss challenge June 1st. So look them up as well, because I think that's also a great initiative to do online. And have a great summer. I will see you probably in a couple of weeks. I'll talk to you soon. Bye-bye.